Bueno, what's up, guys? Hello. I'm very happy here to start in my series of podcasts. We are gonna do something. I think you saw my show, but it's gonna be named Master Zone. Why Master Zone? Because I'm lucky that be surrounded by the best ones in all aspects of in sports, medicine, fitness, and I'm gonna have a series of interviews like one you saw before in my show Master Zone. So we're gonna start giving you information and tips about training, about nutrition, about healthy way of life. So today I'm starting with my friend Dr. Nassery, that I met him for how long, Doctor? We know each other.
I was thinking yesterday, I think it's about 15 years.
15 years, it was around 2003, right?
That's when we started. I met you when we were playing soccer.
So it's not 15, it's like a 20 already.
Yeah, I guess so. I guess so. That goes.
When we were,
time flies by.
We were young, faster, skinnier,
well,
more
I was
hair.
older than you, but yes. Right around that time when we kept playing all the way, I think I played my last game back in 2012. That's when my foot injuries got to a point that I could no longer sustain.
Can't do it anymore, right?
I couldn't do that anymore, and then that was a sad day. I was in a little bit of I went through a little bit of a depression, you can call about it. And then I started running, just very slowly in a straight line.
Right.
And I did that for a couple of years, and I lost a lot of weight. Like, wasn't even paying attention. And
at that point I was telling you, lift weights.
Correct.
Remember?
And my wife kept telling me, you don't look so good. And I was like, I feel really good. But but I had lost so much weight. I didn't realize within the first 3 months I had lost like 30 pounds.
Right.
And that's when I started looking. I was like, yeah, she has a point, I don't look so good at 160. Normally I was like 188, 187. So that's when I contacted you and started saying, you know what, let me go to your gym and see if we can do some lifting, because my body type is so that I'm a really fast burner.
Right.
And I didn't need too much help in that department. So
see, that's one of the misconceptions that I have all the time with the people who want to come to train. No, I want to lose weight, I'm going to start running, and I'm going to lift weight later.
Right.
Yeah, running helps to burn calories, but at the end of the day, you burn more muscle, and it's unhealthy. You need to keep a balance between both.
That's right.
Both worlds.
That's right.
So it doesn't worth it to lift too much weight and not be able to run 100 meters. That's bad too.
Correct. And
so
a lot of these things, learning about your body, as you know, the type of practice that I do, I pay a lot of attention to the full body movement and function and connectivity. And I realized I had no muscle tone. I don't know if you remember the first times I came here and you had me do push-ups, and you were calling me the culebra. You were like, what is that, la culebra? You're doing the snake. What is that? I had no integrity. I had no muscular integrity to hold my body. And that actually correlated for me in work, and to start to apply that to my patients, to be honest with you. And I tell them, okay, we can get some of your work, better, some aspect better, but you need to start exercising.
Yeah, for me it was the first time that I hear all the things that you teach me about the connection of the jaw, the teeth, the posture. I say, and when you start explaining to me, it makes a lot of sense, right?
Correct. So, I've been in practice for 30 years now. Actually, this is the 31st year. And within 7 or 8 years into our practice, I realized that I was really getting bored of the usual, what we call drill and fill dentistry, the basic dentistry, that what 95% of people probably experience out there. You just go to a dentist, you have a cavity, they fill it, you have a broken tooth, they put a cap on it. And I started getting really bored of that and I got interested in more what we call the nuts and bolts of dentistry. Why are things happening? Why is somebody cracking their teeth? Why, somebody would come in and they have like 6 or 7 cavities. And you have to remember, I practice in Miami Beach, and I don't exactly have clientele that are uneducated and don't have proper hygiene. These are well-to-do people. A lot of them are very educated, very good means of doing anything they want, but they would come in and they have all these broken teeth and let's say root canals and crowns and implants, and you have to ask a question: why is somebody doing that? This is not a cavity problem, right? So in my socioeconomic area, I don't have those cases. I don't have people that come in and they haven't seen a dentist in 3 years, or they haven't brushed their teeth, or they haven't, they don't know how to take care of themselves. And I realized there's a lot of clenching and grinding, and so that whole journey of learning about that took me into this direction of taking care of people with what we call TMJ patients, right?
What is TMJ?
Temporomandibular joint. Temporomandibular joint, and of course, like any dentist, I was also thinking that everything is in here. And as I started studying more into it, I learned that I really need to learn about the neck, because the mechanism of connection of how the lower jaw moves, it's all entangled with a series of muscles that wrap around our head and connect to our neck. So I started following some really famous clinicians, actually in different fields, like posturology and physical therapy. So one of my important mentors is a doctor named Dr. Mariano Roccabato. He's a Chilean physical therapist who has been doing research in temporomandibular joint disorders for the last 45 years and published many research papers on the field. So I started taking courses with him, and I realized that, wow, as a dentist, I had my vision so narrow. I was just looking at the teeth, and then I said, okay, I'm really good. I'm looking at the jaw. But in reality is that I had to learn everything about the neck. As it turns out, the dynamics of the movement of your lower jaw affects the position of the head, and the position of the head goes hand in hand with C1 and C2. So that means that whatever I do, wherever I position my lower jaw, is going to affect C1 and C2. And if you know about spine, is that if C1 and C2 move, everything down below, it's all the way to your sacrum, is going to be. So that whole journey of learning about that and how to fixate and correct these patients and stabilize them.
I'm sorry, I remember one case that you told me one day that you saw a guy, and I think he has pain on the knee.
Yeah.
And you told him that it was for your posture from his maxilla of his jaw was in the wrong position.
Correct. So
and when you fix that, you fix the knee pain.
Correct. So if your jaw is tilted to one side or another, in other words, so you're gonna, let's say your jaw pulls to the right, so you're gonna pull your C2 to that side as if you're looking at the other way.
Right.
And this is gonna have an effect on the position of your shoulder. Next thing you know, once the shoulder is up or down, your hip is gonna align that, because you're not gonna go to the world like that. You're gonna correct that from the hip, and now all of a sudden, your knee can hurt, your ankle can hurt, So the process of treating these patients, I can stabilize the jaw and correct that. But I work hand in hand with a number of PTs, physical therapists, who have now studied with me, and I always have them go and study with Dr. Roccabato, so you understand what I'm telling you. And then once they start to align these misalignments, so basically your body is one unit, and when you have a discrepancy in positioning, your body is going to make all accommodations to make you work, because you have to get up in the morning, you have to go to work, you have to do daily function. So our body is very good at that. The brain is going to recognize all of those and do whatever it takes for us to go and get up and do our daily function. But as Dr. Rakabat always says, there is no such thing as accommodation. There's only misalignment. So in other words, we misalign other parts of our body to accommodate a bad bite. And sometimes it's not just that. Sometimes it is it's the other way. So a lot of times when I first see the patient, I have to assess them whether it's an ascending problem or is it descending problem. If it's a descending problem, then it is from your jaw. If it's an ascending, I've had patients that came in and they had a short leg.
Right.
And you correct that, and you're like, oh, okay, the body realigns.
I have 2 short legs. My 2 legs are short.
As long as they're professionally short, then they're okay.
So I remember when we did, you correct my body and you did the mouthpiece.
Yeah.
I remember the difference between the regular mouthpiece that I used to use and the one that you gave to me. How it helped me to correct the posture, to breathing. And more in this sport that is, it's not easy. But most of the sports at a high level are complicated and hard to do. But boxing and fighting are a little bit different. So it helped me to improve. I feel getting more air. My position was better.
Yes.
And how explain a little bit to us how can you improve with a good mouthpiece, with a good position? How everything changed when you do the thing correctly?
Yeah. So the story with that is actually is a funny one. It's some years after I had been involved with the whole TMJ scene and treating patients, and we were putting them in what we call this physiologic position. So to give you a quick background on that is that for the last probably 400 years, most of us humans don't have our teeth coming out in the right place. Okay, so if you look at the skulls of today, modern man versus 500 years ago or 1,000 years ago or 4,000 years ago,
the maxilla was bigger.
That's right. You had nice wide arches and you had all these wide smiles, space, and big airways. Whereas in modern man, you see is a much more narrower, less facial features.
Let me ask you. That's why for the evolution, when we start eating processing food.
No, it's what we call epigenetics. Epigenetics is any factor that affects the way we basically express our correct genome. So that's like. Everybody says, that's the way we're going. No, that's not the way. It's only lasts 300 years. Evolution doesn't happen in 300 years.
Right.
So, no, it's effect of modern society. So anything from pollution is right with industrialization. When we started making factories and a lot of smoke and processed foods and all kinds of different things. So in the mouth, you have to remember the same forces that will allow us to develop the proper shape are the same forces that can make us have malocclusion or incorrect shape. So think about the rest of your body. When we see somebody here that has a really good fit body, what do we say? Yeah, this guy is doing his exercises in the right functional path, correct? How many times a day you see people doing their exercises in the wrong work, short range of motion or weird, and you see how the muscle develops. It doesn't form in the correct. So in the mouth, it's the same thing. Teeth on their own, they don't have a thought process of where we're going to be. They're going to go where the bone is, correct? And just like everybody else, every process in our body, how does the bone grow? By the pull or the push of the muscle.
Exactly.
So if you think about it in those terms, what muscles do we have in our mouth and around it? So we have the tongue mainly on the inside, which is the force that's supposed to push our jaw forward and outward. And we have lips and cheeks on the outside, which is the limiting factor. Now, the average tongue has about 600 grams of force, and average lips and cheeks has about 180 grams of force. If the tongue is in the correct functional path, which is what? The correct swallow pattern, the tongue should always be sitting in our palate. And we're always supposed to be breathing through our nose. And our lips should always be sealed. If you're not speaking, eating, the tongue should be resting in the palate. And when you swallow, the tongue should not move back and forward or backward or forward. It should be actually a bracing motion. It's kind of like does a move like that into the palate, which is the floor of the nasal air passageway, correct? So imagine that happening 2,500 to 3,000 times a day in a growing child. You will have a nice facial form as it grows horizontally. Remember, that's what we say, oh, that's an attractive person when they have good horizontal growth. But as the modern society started happening, and all these allergies started with the pollution and the processed food, nowadays we're at the stage that 75% of kids have some sort of different degrees of allergic rhinitis. They can't breathe through their nose. So what happens? The mouth opens up, the tongue falls on the floor of the mouth. So now the whole growth of mid-face falls behind. The arch gets narrow. There's no room for the teeth. Now we get crowding and say, oh yeah, you're gonna need braces. We need to stop this way ahead of time. So going back to your question about the mouthpiece. So it was about 2005, 2006, and I was at a national meeting, which was a meeting of all these doctors that we treat TMJ patients. And as we were just talking after the seminars, always some of the best talks are after when you're having a drink with some friends and stuff. And we started talking about, oh yeah, I treated this patient and this one and that one. And we all of a sudden realized that we have similar stories. Like I remember treating this physician who had a really deep bite and hated his smile. Essentially, he came to me because he hated the smile, and the wife and the kids, they were like, we can't stand it, your smile. So that's why he came. And when I saw him, I said, listen, I'll fix it for you, but I need to fix it the right way. Your bite is totally wrong. I'm going to correct it. So after I repositioned him and fixed his teeth, he's like, Dr. Nassery, I have to tell you, at the beginning, I thought a lot of the stuff you were saying is bullshit, but nowadays, not only I'm sleeping better, and my wife says I don't snore as much, but I'm killing everybody on the tennis court. My forehands are so much stronger, my serves are so much, I'm killing everybody. And so we had a lot of stories like that. And so we were sharing, and the guy was like, yeah, I treated this crab. This guy was from Canada. It's like this crab fisherman, and when he was taking the traps and put him in his boat, he always had difficulty. And once I fixed him, he told me that one day he went out and with his normal, and he threw the trap clear over the other side of his boat. He's like, man, what did you do to me? I'm like stronger. And then we realized that by realigning the jaw, that's when we kind of like ding, 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 light bulb came in, and so, by correcting that, we realigned the neck. It's not like we put muscles on them, but once the neck is in the proper position, now they have strength and they can dial up their muscles much easier. Right? So you have, again, the central and the centricity of the spine is super important. So we started thinking, what if we do this for elite athletes? So from 2007 to 2009, we ended up fitting over 200-300 professional athletes between NFL, NBA, and we started seeing excellent results. All of these guys were already elite athletes, but by just tweaking their neck, the reaction time increased. We had studies done at Rutgers University, and they showed that the explosive movement on all these athletes improved. So not only that, the range of motion. I remember treating a couple of secondary defenders in NFL, and the guy, after I put his bite in the right place, he was like, man, I can turn my head. Do you know what a difference it makes for me to do that, to be able to see behind me as I'm running after my, defender, after after the receiver, So I was like, listen, whatever. I fitted a few of the hockey players on the Panthers back then, and the guy loved it because he was like, yeah, every time I go in there, he was one of the top players, but when he gets checked, he had neck pains, and he would have to come out after a couple of checks. He would have so much neck pain that he would say, take me out, because So once I put that mouthpiece for him, He was like, man, I can get checked as many times. Now I can play all I want. I don't have the neck pain anymore. And I remember he got traded to Dallas. And then a couple of years later, he called me frantically. He's like, oh, Doc, can you make another one? I lost mine, and I have games coming up, so I had to make another one,
Right.
shoot it up to him to over there. So it was fun for me. It's that part of it was fun. I've done, as you know, a number of boxers and MMA, and the thing that they like about it, once you get centricity in your spine, your range of motion improves, so you can turn your trunk range of motion. So as you know, for a boxer or somebody that hits.
No, for I know all kind of sports. I always, my thing is the fighting, right? Even if I do condition and strength training for a lot of athletes, my main thing is the fighting. And when I start teaching people and I explain how everything works and how everything is connected, that you don't need to be a 250 pounds muscular guy to make self damage, because it doesn't mean the
Right.
size of your bicep or the size of your leg. It's how everything is connected and how you engage everything.
That's right.
That's when you see the big difference, right?
That's
and
right. Because
the
power
same with
without
your-
flexibility
Exactly.
doesn't mean anything. How many times I've watched fights, especially guys that come in and super like cut and build out, and the guy on the other side is like totally raw but no muscle formation, and totally
Right.
knocks him out in the first round. Like the stiffer you are, the less power you have.
Exactly.
Doesn't matter how much muscle mass you have. So flexibility is extremely important. And as you remember, I did. I made one for our common friend. What's his name?
We have so many friends in common.
I know.
What he do?
No, the Muay Thai champ.
Gregory.
Yeah, Gregory. I'm sorry. So when Gregory was my trainer, when I was coming here, we became good friends, and I said, "Hey, you know what? Let me make one for you as a gift." So, and he was already a champ, and I said, "Listen, let's you give me your feedback, honest feedback, what you feel." So, and he's already a very athletic, very good position person, and I made that for him. And the first thing when I put that in is he's like, "Wow, I feel like nobody can move me in this position." He said the stability that I feel in my field, and this is a guy that's super in tune with his body, And I know he had a couple of more fights after that, and then he retired, of course. But he was like, "Man, without that, I don't go anywhere." That is like his most prized possession, and still to this day, I think he wears it when he does teaching and training for other people. But so those are the types of comments I would get, and it feels good for me. It's sort of a hobby on the side with my dentist.
Yeah, no, it's helping and it make people feel better and improve. It's
Yes.
sometimes it's better than
Because when you get to that
manual
level
recognition.
the slightest improvement can make the difference with the next guy. All of these guys, top guys, they're always looking for that edge, because all of them are good, all of them are great athletes.
Right.
So every little bit counts.
And we like athletes, we go through all the things that we were talking about, improvement, all that stuff. But one thing that always concerns is we are constantly with injuries.
Right.
So in my case, and you know that, I so many years of fighting and jumping and doing jump, all that stuff.
Sure.
My Achilles were close to blow.
That's right.
So, and I told you one day, I don't know what happened, and that was when you introduced me with the PRP therapy.
Yeah, that's another interesting part of my practice. As you know, about 17, 18 years ago, I started getting into a lot of, so aside from TMD, I do a lot of surgeries.
Right.
You've had a few with me already yourself. And just like any other seminars, I was at a seminar, it was like a surgical seminar. I was like 3 days in there and watching this oral surgeon putting this incredible surgeries, like totally taking gums off and, cutting bone from one side, putting it on another side. After by the end of the third day, I was like, wow, man, this is crazy, because patients, he kept saying, yeah, people have no problem with this and people have no problem with this. And, in dentistry, we have a little saying, we say, the specialists have a fling with the patients, but general dentists, we marry the patients, because we see them over and over. And so we always hear basically the complaints. And people say, oh, yeah, man, that thing I did here, that surgery, I still feel something strange, or this thing's still not the same, doc, But they never. So to them, everything is a success, because they never hear the complaints. We hear them. So this guy was doing all these surgeries, like, yeah, the patients, nothing happens to them, and they're fine, and blah, blah. I'm like, okay. So at the end of the day, on the third day, all of a sudden, 4 o'clock, he brings this guy. He's like, yeah, I want to introduce you to this gentleman from Spain. And this little guy comes in, and he's like, yeah, we do this stuff in Spain also, but this is what I do. And he puts this machine. It's like, I take the blood and I separate these plasma from it, and there's healing factors in all of us. And I totally resonated with that thought. I said, yeah, we all have the stuff in our body to heal ourselves. And he starts to show how he does his bone grafting. It's a lot less complicated and a lot less intrusive. And I said, wow, this is great. I walked out of there. I went to the booth and I said, I want to order one. So I started using that material in my day.
So that's it. What, you take the blood?
You take the blood, you spin it. Of course, with this specific, there's lots of different ones on the market. The one that I have is from Dr. Eduardo Anitua from Spain. This is the guy that all the biggest sports figures in the world went to. From all the soccer players to Nadal when he was having problems with the tendonitis, to Kobe Bryant when he had problems with his Achilles tendon. They all flew there to see him. So naturally I was like, okay, this system, because it all has to do with this, what speed you're spinning, what angulation you're spinning, how many minutes you're spinning. There's a lot of intricacies to the program. So I wanted his formula. And I started using it in my daily surgeries, and I saw that how soft tissue heals. Amazing. It was like 24 hours looked like 1 week healing, and 1 week healing looked like 1 month healing in normal. So I realized I was using it for some time, and then if you remember back in 2014, my father came in, and I was keeping him with me, and he was already like 89 at that point, and he had a lot of, at that point, his knees really bothered him. And I knew there were people that were putting these stuff in different joints, but I hadn't done it.
Guys, hope you enjoy the amount of information that Dr. Nassery gave us today. I'm going to put his information. You can contact him whatever you need to ask or whatever you need. And thank you very much for coming.
Thank you for having me.
Okay.
Appreciate it.
And let's have to see if we can go to play soccer again.
Oh,
one day.
I'm working on it. I'm working on it.
Maybe we can go to Leon Medical Center and play with those 70, 80 years old guys. Maybe we can.
The geriatric league. We have to find a geriatric
something
league.
like that. All right, doctor. Thank you.
Good to see you. Thanks for having me.
See you soon, guys. Thank you, doctor.